Hi, Assalamualaikum warahmatullahi wabarakatuh, and very good evening, everyone. So, my name is Nurhayati binti Muhammad Zamri, and all my teammates today will present about disseminated intravascular coagulation disease for our assignment to clinical hematology. So, our lecturer is Madam Najiha Bisri. Alright, so this is our group member for today, including me, Hayati Zamri, Atika Nasaruddin, Tan Shifrin, and also Fakira Adlina. Right, so table of contents for our presentation today, including introduction, etiology and symptom, pathophysiology, investigation, treatment and management, and also conclusion. Right, so I will pass to first presenter to proceed the presentation.
Assalamualaikum. So I will start this presentations with the introduction. So the introductions of disseminated intravascular coagulations. Okay, disseminated intravascular coagulation disease is a disease caused by the abnormality of blood clotting throughout the body's blood vessels, in which the conditions of the proteins of this disease is become overreactive. The development of this disease may be quick in over hours or day or and may be more slow. Okay, next, the etiology of disseminated intravascular coagulations disease. So in disseminated intravascular coagulations disease, there is four etiology, which is injury, inflammations, infections, and cancer. For the injury, it caused by the accident that caused major damage to organs or tissue. The inflammations caused from the blood transfusions reactions. The infections like sepsis, and cancers like leukemia. Next is the symptoms of disseminated intravascular coagulations. The symptoms of DICD including trauma, sepsis or severe infections, organ destructions, for example like severe pancreatitis, obstetric calamities, for example like amniotic fluid embolism, vascular abnormalities, for example like Kasabach-Merrick syndromes, and large vascular aneurysms. And next is the severe hepatic failure, and lastly is severe toxic or immunologic reactions. Next, I will pass to Fakira Adina for the pathophysiology.
Okay, so hi, Assalamualaikum. My name is Fakira Adina. So now I'm going to present about pathophysiology of the ICD, or disseminated intravascular coagulation disease. Okay, so as you can see, this is a flow chart for pathophysiology, and it is all begins with various underlying condition, which this various underlying condition can be such as sepsis, trauma, or malignancies, or it can be also on other underlying condition which can lead into the ICD. So this DIC were characterized by the activation of intravascular coagulation, which it will then lead into fibrin deposition. And this fibrin deposition can be classified or can be divided into three, which is coagulation, fibrinolysis, and microvascular thrombosis. And both coagulation and fibrinolysis will lead or causes will cause into bleeding, and microvascular thrombosis will cause into organ failure. So next, on the next slide, I will explain more details about the flow chart. Okay, as what I've been stated earlier, it is all causes are start with various underlying conditions such as sepsis, trauma, malignancies, and many more, which this DIC were characterized by the activation of intravascular coagulation. And when intravascular coagulation activate, it will lead into deposition of fibrin, which this fibrin deposition can be divided or classified into coagulation factor, fibrinolysis, and microvascular thrombosis. So I will explain firstly on the coagulation, which is coagulation is when coagulation cascade were activated and it yields the thrombin. And this thrombin will convert fibrinogen into fibrin. And this conversion will lead into bleeding. So how about fibrinolysis? Okay, next slide. Okay, fibrinolysis is when there's activation of fibrinolytic system in which it generates the plasmin for lysis. And this fibrinolysis function is to breaking down both fibrinogen and fibrin. And the result of breaking down both of these fibrinogen and fibrin will be result in FDPS or FSPS, which FDPS can be known as fibrin degradation products, or FSPS can be known as fibrin split products. And both of these result will cause bleeding as well. So last but not least is the microvascular thrombin, which it will lead into organ failure. And as what I've been stated earlier, both coagulation and fibrinolysis will lead into impaired coagulation, which can cause the bleeding. So that's all from me. Next, I will pass to my group members to talk about investigation.
My name is Tan Xuefen. Now I will talk about the investigation. There is no single test that is diagnostic of DIC. Diagnosis is usually based on combination of clinical and laboratory features. Often multiple and frequent testing is required. First is peripheral blood smear. Peripheral blood examination shows fragmented red cells like schistocyte helmet cells, or blood film and thrombocytopenia are present. Second, complete blood count. In the platelet count, shows decrease in the number of platelets. Third, prothrombin time and activated partial thromboplastin time. All the coagulation screening tests are prolonged due to consumption of coagulation factors and inhibitory effects of fibrin degradation product. Next is D-dimer test. The test measures D-dimer, a substance that is released in the blood when blood clots dissolve. This test shows increase in the level of D-dimer. Furthermore, serum fibrinogen test. This test is to measure how much fibrinogen is in the blood. Fibrinogen is a protein that helps the blood clot. This test shows decrease in the level of fibrinogen. Last but not least, ethanol gel or protamine sulfate test. When ethanol or protamine sulfate is added to patient's plasma, fibrin monomers dissociate from fibrin degradation products and spontaneously polymerize to form a gel. This shows a positive test result. Next, I'll pass to Hayati to talk about the treatment and management.
Alright, so I will talk about the treatment and management for the ICD. Alright, so for treatment, first we can do to treat the ICD is giving medication such as anticoagulants or blood thinners to the patient. It can be given as a pill, injection, or IV. Second, it can be by treated the underlying disease first. The IC may go away when the underlying disease has been treated. Third is plasma transfusion, which it provides clotting factor to stop or prevent the bleeding. Fourth is oxygen therapy. It will allow more oxygen to reach the lung, the heart, and also the rest of the body if blood clots are preventing oxygen from reaching the patient's organ. Next, the treatment can be given is platelet transfusion, where it helps quickly rise the plasma level to stop or prevent the bleeding. Last but not least is clotting factor replacement, such as Fibrinogen. It is used to stop the bleeding. Alright, next is management. So what we can do to manage the DICD patient? First, we can follow all the treatments and testing for the medical condition that cause the patient the ICD. Second, talk with your doctor about how often you should schedule hospital visit and also the blood test. Third is call your doctor if you have any new symptoms or your symptoms become more worsened. Right. Fourth is take all medication regularly as the doctor prescribed. So do not change the amount of the medication or skip any dose unless your doctor tells you to do it. Alright, so I will pass to Tan for the conclusion part.
Okay, so in conclusion, disseminated intravascular coagulation (DIC) is an acquired disorder occurring in a wide spectrum of underlying diseases and characterized by widespread systemic activation of coagulation with formation of microthrombi in small blood vessels and bleeding diseases secondary to depletion of coagulation factors and platelets.
Okay, so that's all from us. This is our reference. Thank you for watching.
Recording stopped.
Okay, guys.
Aku nampak Fakira macam nak senyum masa
Allah.
disebut regularly.